Hey everyone, Dr. Luke Peterson here, physical therapist with the Knee Replacement Therapist. You're watching the Need to Know show. For this video, we're going to talk about ice and icing after knee replacement surgery. So, is this beneficial? If it is beneficial, what are the benefits? What's kind of the consensus when it comes to ice and using ice after knee replacement surgery? So, the supported reasons or the reasons commonly discussed for using ice after knee replacement surgery are one, decreasing swelling and decreasing inflammation, decreasing pain levels and pain intensity, and potentially also increasing your mobility and the range of motion of your knee. Now, the short answer to does ice help with each of these things? The short answer is that it's relatively inconclusive, actually. There's a lot of debate back and forth about is it beneficial, is it not beneficial to do ice after surgery or after an injury. So some studies will show that ice does help reduce pain or does help with reducing inflammation and swelling. And then you'll show studies that show that there's no benefit at all from using it. So it's really inconclusive, and there's a lack of high level, unbiased, high quality evidence and research to determine the answer one way or the other. Now, what I always like to say is the risks of using ice are really small. They're very minimal. There are some risks if you leave it on too long. You might cause some irritation or problems to your skin. You might cause some circulation issues, but typically, if you're paying attention, you're using it the right way, not keeping it on too long, paying attention to if it starts to hurt or burn or anything like that, then you should be okay. And the risk is really relatively low and relatively small for the vast majority of people. So that's one thing to think about, is the risk is really small. Now and the cost and the expenses to get ice. So of course there's all sorts of fancy icing machines out there. There's things that give you compression. There's things that circulate the ice through the contraption, whatever it is, or the ice water. There's a lot of different technological things out there, and some of them are really great and really beneficial. Some of them are more hype than anything else. They do tend to have a little bit more benefit just because of the fit on the knee, the ability to maintain a good cold temperature a little bit longer, and things of that nature. But at the same time, you don't have to spend that money on something overly expensive. You can just have your common, bag of peas or putting ice in a bag. So it's relatively low cost and easily accessible to get ice too. So when I think of those things, that it's one, the risk of using ice is very, very low. The cost and the availability of it is pretty widespread and pretty low cost. And the benefits are potentially some really good benefits, potentially maybe not that beneficial, but probably won't do anything harmful. So with all that considered, I always like to advocate that it's perfectly a good option to try ice and use icing after your knee replacement surgery. At the same token, it's not the end of the world if you're not icing all the time, you're not icing consistently, you're not on and on and on icing all the time, because it's really kind of inconclusive. But the main thing is to think about how it affects you and how it feels. So if you ice and it really helps reduce your pain levels, or you notice that it helps maintain your swelling at a good level, or you notice that you're able to bend the knee a little bit more, then of course, go and do a bunch of icing and ice all the time. If you don't notice really any benefit from it, then maybe it's not for you, and that's okay. With things with, the opiates and opioid pandemic, of course, is still something that's very prevalent, even with the COVID going on, people are still abusing opioids, and it's still something very important. It's a good pain management strategy for a lot of people that doesn't require taking something that definitely, pain medicine, narcotics that have a lot more risks involved with them, such as, of course, addiction to those drugs. So I always like to say that the potential benefits outweigh the potential harms, and the risk of the potential harms are much, much lower than the chance of having a potential benefit. So all that put together, I advocate for icing. How should you do it? Use common sense. Some places will say 20 minutes on, 20 minutes off. You might see somewhere that you can keep the ice on for up to 2 hours. I always tell people, feel free to ice on and off, feel free to keep it on for a longer duration. Just make sure that you're periodically checking your skin, checking your circulation, checking your sensation, especially if you're using compression, because that can compress some of the nerves and some of the circulation to your legs and knee. But, use common sense, follow the recommendations, follow the procedures that your surgeon gives you, if you have a device or bought something, that if that has instructions, make sure you're following those instructions, and just, again, use common sense. So, should you ice after knee replacement surgery? Not the end of the world if you don't, but potentially has a lot of good benefits and relatively low risk. I'd love to hear what you guys think about it. For those of you going through the knee replacement journey, are you using ice? Do you use just common ice bag, or do you have a machine or something that you use, or some sort of device, or you found one really beneficial? I'd love if you shared that. And if you have any questions about ice, feel free to share those, and I'll try to help answer those and give you a little bit more specifics if that's something that you might have questions about or want to know more about. Thank you very much for watching, everyone. This has been the Need to Know Show. We're talking about ice and cryotherapy if you want to use physical therapy lingo, and after knee replacement surgery. And I'll be back tomorrow with some more videos. Take care.